Hello, welcome, and today in this video we're gonna talk about
Let's talk about blood types. So first of all, blood types, there are going to be three major types of something that we call agglutinogen. And just to explain what is that, these agglutinogens are either glycoproteins or glycolipids. So in other words, it's a protein or it's a lipid, and this is going to be present in the surface of the erythrocytes. So in the surface of these erythrocytes, like I said before, also known as the red blood cells or RBCs, there are going to be three classes of agglutinogens. The first one is going to be A. The second one is going to be B. And the third one is going to be D, also known as the RH factor. Fun fact, RH stands for rhesus, as the rhesus monkeys, and this is where it was actually discovered. So in other words, people that have agglutinogen D or RH, it means that they will be either positive, or if they don't have it, then it'll be a negative type of blood. So in other words, agglutinin D or RH factor is only present if the person is sensitized to these actual agglutinogen D. The same goes for these other agglutinogens A and B. If a person has A on its cell membrane, it means it's type A. If it has agglutinogen B, then is type B. Also, there's such a combination of A, B, and all of the above or none of the above. So if it's none of the above, then you could say you have a fourth type of blood type, which is type O, which is none of the above. So in these 8 boxes, we're going to do the types of blood.
let's take a short discussion break now, shall we?
So let's review the cell types. I'm going to start by making these circles, imitating each cell, determining each blood type. So we're going to start with type A. Like I said before, if you have a patient that is type A, it means that this person has type A agglutinogen in the cell membrane of the red blood cell. Then there's the type B. If the person has the agglutinogen B, then this person is type B. Now, if this person has both A and B on the surface, then this person is type AB. And if this person has none of the above, it means this person is type O. Now there's a major distinction because some of these patients are going to be either positive or negative. Like I said before, this is given by this agglutinogen D or RH factor. So saying that this person has the agglutinogen D as well in the cell membrane, I'm going to do it in all of these cells at the top, it means that they are positive, right? So now you're going to have a type A patient, type B positive patient, type AB positive, and type O positive, right? Now there's also the type negative, right? So for example, for type A, I'm going to go ahead and do type B, type AB, and type O. In order for them to be negative, it means that they don't have the D factor or the RH factor. So in other words, for type A negative, they must have only their A agglutinogen, but no RH factor. So they end up being type A negative. Now, in order for patient to be type B negative, it means that they only have these B agglutinogen, but no D agglutinogen or RH factor. So they end up being type B negative. Now, a patient that has type A and B, it means that they have these two, A and B, but no RH factor. So that means they are type AB negative. And for patients that are O negative, it means that they have none of the above. No A, no B, and no D. So now that we have these explained, there's one last thing that we have to explain, which is who can give blood to who and who would be the universal donor. In this case, because type O negative has none of the above agglutinogens, it means that this person would be the universal donor, because this person can give either blood to type O positive or to any of these individuals right here. Now, another interesting fact is that everyone that is negative in this category can give to their counterparts at the top of this table. So for example, this type A negative can be a donor to a type A positive patient because they don't have the RH factor, and so it won't react against it. However, a type A positive cannot, let me put it in red, cannot give blood to a type A negative because it will react against it. The same with type B. So a type B negative can donate blood to a type B positive, but not the other way around. The same with type AB negative. AB negative can donate to type AB positive. And then the same here, a type O negative can donate to a type O positive. One last thing is that there's also a universal recipient, which is going to be your type AB positive. Because this person has the three agglutinogens, it has A, B, and positive. So this person can receive blood essentially from anybody right here. The only problem is that this universal recipient cannot donate blood to anyone except for another patient that has this same type of blood. And actually this is one of the rarest types of blood around the world. It is also in the case of O positive, it's fairly common here in the United States amongst Hispanics and African Americans. This one is fairly common, as well as this type A type of blood. Type O negative, it's a little bit rare, but not as rare as the type AB positive. And that's it in terms of blood typing.
I hope this video has helped you, and if you like this shirt, it's now available on etsy.com/Queen Mary Anatomy. Thank you for watching and see you next time.